According to the Colorado Department of Public Health and Environment, more than 5,500 people have died from opioid overdoses in our state since 2020. There are multiple organizations in Colorado working to provide treatment and help for those struggling with addiction. Last week, they held a virtual summit to talk about the major concerns healthcare professionals are hoping that state legislators will help them solve during the upcoming legislative session. Dr. Stephanie Stewart is joining me now. She's from the Colorado Society of Addiction Medicine, and you're a part of that summit. So tell us a little bit more about what opioid usage looks like in Colorado.
Yeah, so even though we have seen rates decreasing, they are unacceptably high. So we really were joining lawmakers together to talk about some strategies to improve the way we respond to the opioid epidemic, especially as we have more opioid settlement dollars coming in over the next couple of years.
Sure. And what does the treatment process look like for some of these people?
Yeah, so there's 3 FDA-approved treatments for opioid use disorder. The first is methadone, Suboxone or buprenorphine, and then naltrexone.
Do you think that there are any ways that these could be improved? You know, as you're looking at the way that we have kind of handled this in the past, do you see any room for improvement here?
Yeah, one of the things we offered to legislators was to improve the prior authorization process. So right now there's burdensome paperwork that's required to complete to receive some of these treatments, and we're hoping we can streamline treatment and make it more accessible to patients.
And what about some of these treatment centers? Or is there anything that we can do in that area?
Yeah, I work for Community Medical Services. We have 7 methadone clinics or opioid treatment programs across the state. So improving access to treatments like Suboxone and methadone will improve the opioid epidemic.
Mm-hmm. Obviously, this is a huge thing that we have been talking about, for a while. And it obviously is big enough that all of you guys felt like it was necessary to come together and talk about this, right?
Mm-hmm. Yeah, and honestly, everyone can do their part. Everyone can carry naloxone and know how to respond to an opioid overdose.
Mm-hmm. And my last question for you, if someone is struggling or knows someone who's struggling, what are some pieces of advice that you might be able to give for those people?
Yeah, the first thing they can do is go to findtreatment.gov, and there they can locate treatment close to them that's appropriate.
Thank you so much, Dr. Stewart.
Sure.
Really appreciate you coming in.
Thank you.
Really important topic. Thank you.